Hi, welcome to One Smart Nurse. I would like to ask you to please read the disclaimer in the description below before you proceed to watch this vlog. Today's vlog is going to be about strep throat. But we're going to first start talking about different types of sore throats. We're going to talk about the three main complaints of sore throat, or the three main types of sore throat. A sore throat is often caused by a throat infection. A throat infection is also known as pharyngitis. And they are often caused by cold, such as the common cold. There's no treatment with an antibiotic for this because it is viral. The next type is also viral. It's called mono, and mononucleosis, also known as the kissing disease. It's mostly seen in young people. You often have a fever, a sore throat, swelling to your lymph glands in your neck. If they do a strep test, it comes back negative. But if they do a blood test called a monospot test, that is the diagnosis for mono. And again, it's viral and there is no antibiotic treatment. You just got to get through the infection. The other type is a bacterial infection, and the main bacterial infection is strep throat. And that is the only one that is treated with an antibiotic. Only bacterial infections of the throat are treated with antibiotics. If it's viral, you just treat the symptoms. Now, there are other things that can cause throat discomfort or soreness to your throat. One is very dry air, cigarette smoking, post-nasal drip. So this is allergy season. So if you have allergies, you may have a sore throat. And singing. Singers tend to have a sore throat because they use their vocal cords. Yelling. So I don't want to blame teachers or say teachers yell, but teachers, coaches, people who tend to raise their voices to speak out in a crowd tend to have more complaints of sore throat. And also those who have sexually transmitted diseases such as gonorrhea. That can also cause a sore throat. Now we're going to spend some time talking about strep pharyngitis. Strep pharyngitis is also known as strep throat. The cause of strep throat is a bacteria called group A beta hemolytic streptococcus. Because it's so long, we just call it strep throat. It is highly infectious. You can transmit it to others. What are the symptoms? As you would expect, sore throat, painful swallowing, a fever, headache, swollen lymph glands, and maybe even nausea. Upon examination, you would find redness to the throat and maybe some white patches that appear to look like pus in the back of the throat or on top of the tonsils. A way to test to see if it is strep throat is to do a rapid strep test at your doctor's office, and also they can do a throat culture. The rapid stress test comes back the same day, but a throat culture can take 3 to 5 days. Treatment, of course, would be the antibiotic because it is a bacterial infection. To address pain of your throat, it's best to use warm liquids. So drink plenty of broths, teas, or even take some apple juice and warm it up like a tea. Throat lozenges can be very soothing to your throat. And also gargling with salt water. You would take 1 teaspoon of salt, put it in 8 ounces of warm water, and gargle 3 times a day. It's very, very soothing. For pain as well as fever, you want to consult your doctor to make sure that you can take acetaminophen, which is Tylenol, ibuprofen, or naproxen. Now also, because it is painful to swallow, you should eat a soft diet. Applesauce, pudding, soups, milkshakes, and stay away from hard foods like pizza, fried chicken. Things that are hard are going to scrape along your throat as it goes down. And just make sure you drink lots and lots of fluids and get plenty of rest. Now, if you are having any difficulty breathing, drooling, if you're spitting up saliva because you just can't swallow it, if you're unable to open your mouth completely, if you have a fever of greater than 104, if your throat is just severely uncomfortable, if you develop a widespread rash, if you have ear pain, if you're diabetic or you have a low immune system, and you've had a fever for more than 3 days, you need to seek immediate medical attention. Now, in that, I just want to also add, after 24 hours of taking the antibiotic, make sure you change your toothbrush so you don't reinfect yourself. And remember, don't share your personal items with others. Complications that can occur from strep throat, you can develop an abscess near your tonsils. You can develop a rheumatic fever, and you can even develop a kidney infection called a strep kidney infection. Okay, when can you return to work and school? As long as you are fever-free for 24 hours and you have taken your antibiotics for 24 hours, you can return to work and school. If you have any questions, please don't hesitate to ask them in the comments below. Make any additional comments that you want to make. Subscribe to my channel, and don't forget to like the button, to hit the like button. All right, thanks again, and don't forget, I want to know what you want to know. So make comments below. Thanks and have a great day. Bye-bye.